ஸ்டார்ட் பண்ணிடலாம்.
Yeah. Yeah. Good evening, friends. Namaste. We welcome you to the YouTube live session today. Today's topic is stress management. We are super excited to have Dr. Srinivasan on board, sharing his expertise on managing stress. Join us live, ask your questions, and let us work together to create stress-free life on upcoming New Year. Yeah, I am Sunanda from Hyderabad, Dr. Srinivasan sir from Coimbatore, then Anita Ramachandran from Sharjah, then Naveen from Delhi. Yeah, now I am handing over the session to Anita ma'am. Yeah, ma'am, please go ahead.
Yeah, good evening, everyone, and thank you so much for giving me an opportunity to introduce a wonderful person to all of you. And Dr. Professor Srinivasan, sir, is a highly respected consultant psychiatrist with an illustrious career spanning over 4 decades. He has completed his MBBS from the Madras Medical College in 1979, followed by his DPN from the Institute of Mental Health and MD in Psychiatry from the Madras Medical College. His early work as a senior research officer for the Ministry of Welfare laid the foundation for his enduring commitment to mental health care. Since 1992, Professor Srinivasan Sir has been a consultant psychiatrist at the Kobe Medical Center and Hospital in Coimbatore. He also serves as the medical director of the Kasturba Gandhi De-Addiction Research and Rehabilitation Center, an NGO that has treated over 15,000 patients using innovative methods to increase abstinence rates. The center also runs a suicide prevention hotline, helping thousands of people for more than 20 years. With that short introduction, I would like to hand over the session to you, sir. Floor is yours. Thank you so much for accepting our invitation. Thank you so much. Over
Thank
to you,
you
sir.
very much for that wonderful introduction. So we'll start with the question. Sunanda, are you going to start the questions or?
Yes. Yeah, what is stress and how we can manage in our day-to-day lives? It's a very common doubt nowadays.
I mean, stress is a very, very common word and it is used in multiple ways by everybody. Okay, so I mean, imagine a caveman sitting by the side of the fire eating his dinner. Suddenly he turns around at the corner of his eyes, he sees a tiger ready to prowl upon him. So, in a not even a second, in a split moment, he has to act. Otherwise, he will become the dinner of the tiger. So, there is a fight or flight, or in other cases, there is a freeze. These are the three F's that are the hallmarks of stress. So, whenever you face a problem, you either fight or run away from it, or you are not able to decide, and so you freeze. So, what was a life saving mechanism hardwired in our brain and in turn into our minds has become a problem now? And it is life threatening now because we are living with outdated nervous system. That's what I would say in short about stress. So, the problems were very few, occurring rarely, so they had the time to recover. Whereas now, in the modern concrete jungle, we have too many problems, and the basic difference I would say is that the modern day problems are not life threatening, but still we are responding as if they are life threatening. That is where the whole problem is. Like, take for instance a student going to the school who has a fear of facing her exams. Even if she fails, it's not going to be life threatening, but the individual behaves as if it's life threatening. So, whenever she approaches the school, her heartbeat increases and there is excessive sweating. She feels like using the restroom often, and sometimes there is vomiting, all that. So there is suddenly a threatening response, and her body is responding to that, and she is not even aware that her body is overreacting. So, like if it is work or home or an unwanted person with whom you have to spend your lifetime, all these cause what we call chronic stress. Once we realize that we don't have to react in the same way, of course, rationally we are able to understand, but the emotionally and body reactions, they come in an automatic way. In fact, recently when I was reading about trauma, they were talking about the body remembers the trauma even if the mind doesn't. So what happens when the symptoms are more body oriented and you talk to them in a way that appeals to the mind, but the emotions of the body don't take it up? So that's where the whole problem is. So if you have to put it in a very simple way, probably there is a hyperarousal and a constant hyperarousal, and that's what is causing the problem.
What are the psychological and physiological effects when I am having stress?
Okay, first physiological, if you take, as I said, see, if you have to run or fight, you need extra physical energy. So what happens? There is an increased heart rate, which is perceived as palpitation. Then the pressure also sometimes increases. That's why they end up having high BP over a period of time. Then the breathing becomes faster and shallower sometimes. That's why they feel breathing difficulties, as well as sometimes because of hyperventilation they experience dizziness. Then if you have to run or so, the last thing you want is food and other things in your system. So sometimes you feel like even passing motion. That's why there are some people, whenever they have to go out or when they have to face stressful situations, they have frequent loose motions. Other times they don't. And they also feel like passing urine very often. And the muscles become very tight. That's why some people feel a lot of aches and pains and chronic headache. In fact, I often used to say more than 95% of the chronic headache people, they have to meet a psychologist or a psychiatrist, not a neurologist, but they end up seeing them. So it affects the entire body, almost all the systems. There is an increase in cortisol secretion, adrenal secretion. If you have to go into the details, of course, there is always confusion nowadays. Earlier, I used to think that there are some informations which are not needed to the common person, and the medical person will need that. But now everybody seems to be like first year clinical student because of Google and other things, and that's why most of the time they experience stress. There is also what I call illness anxiety disorder that seems to be very common among people because they read so much information. Earlier we used to say that medical students, when they go into their first clinical year and they start reading about illnesses and see patients, they think that they have the same illnesses in them. So almost 10% of the medical students will go through some sort of medical evaluation or other, imagining that they have an illness. Now a common man seem to be having almost the same exposure, and because of that they have the same problem. So stress produces in a lot of people a fear that they may have an illness because they don't realize that they have a physical symptom, which is because of anxiety and stress and not because of the real medical causes. But as I said, all these physiological changes are perceived as a part of an illness, and that causes problem in the people. So that leads to the second set. So there is psychological changes if you look at it. there is constant worry, fear and anxiety, and when you give up, depression. I always say that stress, anxiety, and depression are in a continuum. Early stages, you are in stress, and when it becomes increased in intensity, it becomes anxiety. And as long as you keep fighting, you have anxiety. And when you give up, I cannot do, I cannot handle it anymore, and then it becomes depression. Though it's a oversimplification, this is the way I used to explain it to people for making the understanding easier.
Yeah, it's very clear, sir. Yeah, Naveen, you can ask if you have any doubt.
Yeah, ma'am. Thank you for the opportunity. Hi, sir. Sir, like psychologists and psychiatrists are handling different kinds of stress, sir. Due to handling that stress, they can be have any stress, sir.
It all depends upon one, your skill and capacity. So you feel comfortable handling it, then you may not feel stress, number one. Second is empathy with the patient is different, but you take it too much into your heart, then you start feeling for them, then you may experience stress. So you should know the professional boundaries and your capacities and skill set. If all that are in tune and in sync, then you may not experience stress. But if you think you are not able to handle a problem, leave the stress. I mean, like managing stress may not be much of a problem, but if you are dealing with individual with borderline personality disorder and frequently they threaten to commit suicide and they come with deliberate self-harm and suddenly they get you on a hotline and say that I feel like giving up. In fact, recently I had an individual who rang me up 1 week ago from Bangalore. Doctor, I feel like giving up. I was in a shock and then I got to contact her parents and make the effort, make her come. And then I started working on her very intensely. But these kind of things always produce stress in you because like your liability is beyond the consultation room. It's just not over with that and you become responsible for your patient. So when it becomes challenging, definitely you will experience stress, but you should be able to handle it.
Yes, sir. Thank you, sir. It's crystal clear. The next question is like, as you have had a experience with Ministry of Health, like normal people have stress and they easily handle. In high level, like minister or PM, MP, like that, they do have so much stress for the country as well as for their personal, professional, everything. How do they handle it?
No, no. Basically, stress is only when you are not able to handle it. See, it does not depend upon the amount of work you have to do, the complexity of the work you have to do, amount of time you have to put in, all that. See, for the same problem, there are some individuals who are not able to face it, and only for them it is a stress. The individual who is capable of facing it comfortably, it's not a stress for them. Probably only such people are able to come to that level. So, stress definitely is a limiting factor in your growth, personal growth. You have given me a right stimulus, the ability to handle your stress is going to be the number one factor in deciding the levels of achievement you can reach. Right from your student days, if you are experiencing stress in school, definitely you don't perform up to your potential. You have a great potential, but you are not able to perform up to your potential because of your stress, and that limits you. It prevents you from asking questions, it prevents you from clarifying doubts. So you always go with the doubt. It also affects your self esteem. So it impairs your performance and the amount of marks you can get. If your potential is up to 90, 95, if you are experiencing stress, it can reduce it to a brilliant student can become an average or above average student. And likewise, the kind of job he can get and the kind of goals he is going to set, everything is going to be limited by his ability to handle stress. So people who are able to handle stress just like that are the people who are at the top, right? So it's not that because at the top they are handling it, because they were able to handle it well, they are able to reach the top positions. So they are not experiencing any stress. If they are experiencing stress, they may not be at that position, right? So your ability to handle stress is an important factor in the growth of the individual. It also affects your relationship as well. If you're able to handle stress better, definitely you will have a better relationship. Otherwise, you will experience relationship difficulties. You will experience professional difficulties. You will experience academic difficulties everywhere. Your ability to handle stress is an important factor in coming out with your full potential as well as in your growth and also the goals you set. Everything, probably your ability to handle stress is going to come in the way. Then again, probably stress, the ability to handle, and the self esteem are going to be interrelated. If your self esteem is good, you are going to handle stress comfortably. And if your self esteem is low, then your ability to handle stress is going to be again affected. So
Thank
what
you,
you
sir.
perceive as stress is going to be different for people with different levels of self-esteem and the ability to handle stress. In fact, we also talk about in your growing up years, have you faced stress or you haven't faced stress at all? Like the modern day kids where they get everything they want, they don't face any stress at all. In the first stressful situation, they give up, and that's why you come across people who even attempt or commit suicide when they don't get an iPhone they want and when their parents refuse to give what they want, or when they fail even at a small things they give up because they are not stress hardy. So the stress hardiness comes with growing up years when you are exposed to minor stresses with support and you are able to handle it well, and then you keep growing up in that stage, so you are able to handle stress in the adult life much better. So that's why if you see the people who have come up from very humble beginnings and they have worked hard and grown, they're able to face stress much better than individuals who have come with a well protected setting, overprotective parents, and all that. In those situations, they find it difficult to face stress when they come across stress for the first time as a grown up adult. I think I
Yes, sir.
have given.
Thank you. Yes, sir. Thank you, sir. Once again, it's a good answer. Sir, like in which age period, like a human undergoes adolescence, adolescent, middle age, elder period, which age period he indulge in lot of stress?
No, stress is there in every age group. The reason for the stress differs in different age groups. That's all. So, a person who has handled stress as a kid in his adolescent period, he will able to handle stress in the grown-up period as well. Of course, according to the age and the sex, uh, definitely as you grow older and your independence decreases, and when you become more dependent and your abilities are less, then you may be experiencing more stress. Otherwise, the stress is more with females because of various hormonal reasons, biological reasons, and sociological reasons. Like they are not able to express themselves freely. Now, of course, the times are changing, and because of the times are changing, the conflicts are probably more. The newfound freedom and how to handle it, and the other people who have been in a power dominant position not willing to give up their power or power sharing formulas they are not willing to accept, that's causing a lot of issues.
Yeah. Thank you, sir. Yeah, over to Anita, ma'am.
Yeah, thank you so much, ma'am. Sir, I have a question. Do physical illnesses also contribute to mental health conditions? and stress.
Definitely, definitely, of course, that's a very big topic. Like chronic diseases, like you take for diabetes, diabetes and depression are quite common. So people with diabetes, because of a lot of insecurities and fears about future, fear about complications, and not able to mingle with other people because of the food restrictions and so many other things, they are experiencing more depression. Like that, if there is a illness which causes disability as well, then they are finding it difficult. So people, they will be experiencing more stress. But if they are trained and they are able to overcome that, they will be able to manage, and there will be an improvement in the primary disease as well. Like if you take for diabetes, for instance, if you help them to manage their depression, then their diabetes control is much better. We have come across a lot of patients where they are under very good control with a particular drug, diet, and exercise pattern. And suddenly the blood sugar level goes up, and if you look into the matter, probably there is a recent loss or some other reason because of which they have become depressed. And once you address that issue, then their sugar level comes under control. And we have, in fact, at Kobe Medical Center, talked about starting a therapy program where we give them more psychoeducation as well as a lot of other coping strategies in order to manage the chronic illnesses. Diabetes is the first one in which we have started that.
Okay, sir. What do you think are the challenges with regard to mental health? We are talking about stress and factors that affect everyone's lives. So, what do you think are the challenges that people have with regard to mental health? Because they do not want to approach a mental health professional, even if they are aware of it, and sometimes they are not able to help themselves. So, what are the other challenges, sir?
Of course, as far as stress is concerned, there are a lot of people who are willing to seek help for stress management. Stress management has become more acceptable word. In fact, the cost of stress in the US they have estimated, but in India we don't have proper figures in terms of absenteeism, illness, and all other factors. Definitely, stress becomes the number one mental health issue. And if unattended, it also leads to more anxiety disorders and also depressive disorders. So, in extreme cases, it also causes loss of life and also absenteeism and decrease in productivity. All that are taken into account. That becomes a huge issue as far as stress is concerned. Definitely, as far as stress is concerned, there is awareness, but not to the extent it should have been. So, if we increase the awareness, increase the various, uh, like what you say, in workplaces, especially in academic institutions, these are the two places where we can promote stress management and also formulate specific strategies for that. Of course, there are a lot of people who talk about wellness and other programs. There is no singular entity because of a lot of diversity and a lot of people are involved in it. Probably the focus and clarity is missing at times. That's one of the challenges I would say. So once we increase the awareness and people understand the benefit of managing their stress, as I said to Naveen's question, stress is going to impact your productivity and the heights you can achieve. Once they understand that, and once they also become aware of how it is limiting their progress, then they will definitely come forward once they see the progress they can make with stress management.
Yeah. Thank you, sir. Over to you, Naveen. Ma'am.
Yes, sir. Whether food and sleep affect stress or What are the positive interventions to manage stress?
So definitely sleep is the first casualty as far as stress is concerned. Number two is definitely on the one hand there may be decreased food intake, on the other hand what we call stress eating, and that leads to obesity, and that leads to a lot of other complications related to that. And also like with the latest information technology jobs where people are working with companies at other countries, they are not able to maintain sleep hygiene. Probably the number one thing I would say is like nutrition and sleep are the two important factors which are affected by sleep and which are affected by stress. And if you have to manage your stress, these are the two things you need to focus first. So I would say one, probably you go back to sleep hygiene. So a fixed time to go to bed and fixed time to get up, even if it is late. Suppose your job demands you to be at work till 2 or 2:30. Definitely every day you go to bed at 3 and probably get up at 10 or 11. 7 to 8 hours of continuous uninterrupted sleep is good, and sleep should be refreshing. When you get up in the morning, you should feel fresh. So that is an important thing, and avoiding screen time at least an hour or so before. I mean, normal people, we say they have 2 to 3 hours before going to bed, but people working with computers and their job demands to work till 2 o'clock in the morning or something like that, and they have to sleep. You cannot say that you have to avoid it 2 3 hours before going to bed. So there you reduce it at least an hour before going to bed, and then use bed only for sleeping, not for reading or watching your phone and things like that, and produce a conducive atmosphere for sleep. So, sleep hygiene is an important aspect, and also taking nutritious food, taking care of your nutrition is a very, very important aspect, right from emotional regulation to stress management to everything they talk about nutrition management. So you need to be aware of what you eat. So probably you have to bring in mindfulness here. In fact, for the entire stress management, I would say if you are mindful of what you are doing, like one of the techniques I teach in my group therapy and personality development programs is a technique called 1 hour, 1 minute. This is exactly what I say. At the end of an hour, you close your eyes and recollect what has happened in the last 1 hour. Initially, it was developed as a memory technique. Later on, we found more than 100 different uses. In fact, I used to say, from automatic living to aware living. That's what it brings it. That's why I brought in the mindfulness. Because most of the time, we are not even aware what we are doing, and then we are not even aware what causes stress in us. So that's the reason why I introduced this particular exercise, and it was found to be very, very useful by almost most of the participants. If you do it properly, it's about 14 to 16 times you can do in a day, but very rarely anybody does that. But even 6 to 8 times a day you can do that and recollect what has happened in the last hour. Then you will realize where you have been productive, what exactly caused stress, and following stress, how you were disturbed and how long it took for us to recover from stress. So, like in exercise, they say your recovery time denotes how exercise ready you are. Like you run for some time, after you cool down and stop, your heart rate takes some more time to come back to your resting heart rate. Like that, if you are disturbed by stress, disturbed by somebody shouting at you or something that's bothering or worrying you, how long it takes for you to come back to normal before that trigger stimulated you to the stress level. So all that you can recollect with this. So one is 1 hour, 1 minute. Another one I call what I call the stress diary. If you can, nothing like writing, because you think whatever you do in the mind, it's more fluid, but when you start writing, keeping track of things, and when you recollect and read at the end of a week or a month, then that gives you a lot of ideas about where your stress is coming from and how you are coping with it and how you can change in a way that's convenient to you. So, like it started with sleep and nutrition, and from there we graduated to mindfulness and how to keep mindfulness and how to become aware of whatever you're doing, your experiences, positive and negative, all that. Simply you can bring into focus by doing this one simple exercise called 1 hour 1 minute. Somebody gave a short name as OHOM, something like a WOM. So somebody said it's a 1 minute meditation. So that's how one of my talks got very popular. So 1 hour 1 minute gives a lot of perspectives, a lot of changes, and another important positive aspect about this exercise is that when you know where you are going wrong and what needs to be corrected in you, you are more than willing to do it. Whereas when somebody else is pointing it out to you, then you are more resistant and you probably go to the extent of arguing with them, and you argue so well, whether you convince the other person or not, you convince yourself that you are not at fault and you continue to repeat the same mistake. So that's the reason why when others advise, others try to give you inputs, it doesn't work. But when you find on your own, it helps you in changing a lot of things. In that way, this 1 hour 1 minute and stress diary, keeping a track of what exactly happened, what were the physiological changes, what were the psychological changes, how long it lasted, and when you were able to come back to normal. And then thinking later, should he have reacted in that way and what exactly triggered that? What kind of belief system triggered that? All that, when you go into the details, then it gives you an insight about which is the source of your stress and how you are handling it and how you can handle it differently. So, in order to develop that kind of awareness, these two important techniques, one is 1 hour 1 minute and the other one is stress diary. These two, when you keep following it about 2 to 3 months time, you do it on a regular basis, you will get remarkable changes. I can promise you on that.
Yeah. Thank you, sir. Questions are popping out. Shall we take, sir? Now,
Sure, go
from,
ahead.
yeah, from Sujai. Hi, sir. Good evening. Can we cure anxiety disorder? And what is the best method to cope up?
Now, anxiety disorder, there are different disorders, like from generalized anxiety disorder to panic to phobia, agoraphobia, illness anxiety disorder, all that. And also varying degrees of severity and whether it is related to a situation or not, and whether it's to a particular trigger. So there are so many factors related to that. So you need to address all that, and definitely you can come out of it, provided you follow the practices on a regular basis. One of the important things I would suggest, as I said, for all anxiety disorders, the first aid is what we call the arousal reduction techniques. One of them is what is called Jacobson's progressive muscular relaxation. So that reduces arousal. I normally advise people to practice it at least 3 times a day, once in the morning, once in the evening, and once in the night. You go to bed until you get sleep, because most people with anxiety, it takes a little longer for them to go to sleep. So they keep doing this and they get into sleep deeper. So do it on a regular basis, that helps you. The second technique I have introduced is a very, very simplified form of Vipassana meditation that's called observing your own breath. You start with 1 or 2 minute installments and keep expanding it to 15 to 30 minutes a day. That helps you in a lot of ways. In fact, heart rate variability, that's an important factor that's talked about in various illnesses, especially because the autonomic nervous system, especially the parasympathetic system, is what is affected. So, with inspiration and expiration, that doesn't correlate well in most of the disorders related to anxiety and psychosomatic disorders as well. Recently, I was discussing with a gastroenterologist, and he said that was his thesis when he was doing his PG, right? So once you start doing this breathing practices on a regular basis, once your breathing is regularized, because in anxiety, breathing is the thing that's affected more. And if you take almost all the therapies, if it is either mindfulness based therapy or DBT or whatever therapy you're talking about, breathing and awareness about breathing and changing the breathing seems to be the central theme for almost all these therapies. I have taken it and I have oversimplified it. Just keep observing your breath. Initially, thoughts will be there, but over a period of time, you will reach a stage where thoughts are not there. You will enjoy sitting in this process. A lot of people have come back and said that I have to keep an alarm for the time, otherwise, I just get dissolved into that. And after that, I feel so comfortable. So, it's about quietening the sympathetic nervous system and encouraging the parasympathetic nervous system. That's where the whole focus as far as anxiety disorders are concerned. And you bring in the practices of arousal reduction in many ways. One is focusing on your breath. Second thing is relaxing the tensed muscles. Over a period of time, it also resets the heart rate variability, what they call inner coherence of the heart. That develops, and almost all the systems, whether it is gastrointestinal or circulatory, everything settles to its own rhythm, which is unsettled or disturbed because of anxiety. And once you come to that stage and calmness and nothing disturbs you, then you are definitely out of your anxiety. Yes, anxiety can be cured, anxiety disorders can be cured completely. I normally tell them it's about 1.5 to 3 years' time. Initially, when they need medication, we give it, but over a period of time, we slowly taper and take them out of medication, and they're into their practices. In my group therapy, regularly I emphasize, and a lot of people have come out of medication as long as they keep following it. But the thing is, after some time, once they are comfortable, once they are out of this, then they slip slowly from doing these practices, they give up, and once they fall back into their old pathological pattern and the disease re-emerges. That's where the whole problem is. We teach them a lot of things which are to be followed over the rest of the life, but the discipline, that's where people with discipline who practice yoga or meditation on a regular basis and with their diet and exercise, they're able to be comfortable in most of the things. It's all boils down to your mental discipline. If you can have it and if you can follow these systems over a period of time, you can definitely come out of this anxiety disorders and you can come out of depression. You can change the cognitions that produce depression, and you can uh, understand what are the healthy cognitions, and that way you will be able to deal with anxiety and depression permanently, and you can lead a comfortable happy life free of anxiety and depression. That I can assure you.
Thank you, sir. I hope Sujai watching this. Yeah, from Karthik Deepa, she is your patient. How to recover the attachment, sir?
Like over attachment is what is a problem. Attachment, there is safe and secure attachment as a growing individual. If you have had, then you will not have problem. But if you had an insecure attachment or a fearful attachment as a growing person, then it leads to problem. In fact, most of the people strive hard to please their significant others in their life. In the process, they give up their own dreams. That's where the problem arises for a lot of people. Whatever I do, I don't get the appreciation. I don't. People don't understand me, and I live the whole life for the sake of others. In the end, I mean, nobody cares for me. That kind of lamentings come from people because they go out of their way to seek the approval of other people. So first you have to understand yourself, identify what you are passionate about, and start living a life based on your own values rather than for other people and pleasing others. So there has to be a limit to which extent you are going to be attached with people and going to do what other people demand. And is it going to be at your cost, or is it in a cooperative relationship and other people push you to do what is really helpful to you and for your growth? They are doing it, then you do it if you understand the positive aspects of it.
Thank you, sir. Yeah, over to Nabi.
Yeah, ma'am. Thank you, ma'am. Yes, sir. I have recently undergone a newspaper articles. They have compared the stress management between Western society and Indian society, sir. A organization in some Western country, like they put stress to give higher productivity, sir. It has been worked out, sir. But if the same stress we imposed in our Indian society, Indian people, they said that will result in suicide. It is due to the kind of stress they are imposing, sir, or the toleration level of the people, sir.
No, no. First of all, I don't have a PowerPoint. We call stress into three levels. Okay? Eustress, new stress, and distress. Eustress is stress which is improving the productivity. Right? So, up to a particular level, stress improves productivity. Like imagine a job which is routine, the same thing you are doing, and you are comfortable doing it, but it's not very stimulating. That's where we call it boring. So we need certain amount of novelty, certain amount of excitement, certain amount of push on us. To quote an example, like I would say all of us would have suffered through the exam. Nobody has enjoyed their exam, right? So most of the time when we are sitting for the exam, we make a resolution. Like from next year onwards, I'm going to read from day one of the school, because most of the time we don't do that. We only cram in the last minute, like a month or week before the exam is what many people prepare. Nowadays, of course, there are a lot of schools with regular tests and other things. They make you read from beginning. But in the good old days, when those were not the case, we make a resolution from day one, I am going to read. First day of the school, you come back, you want to keep up the resolution, you read. After half an hour or 1 hour, you wonder whether your hands merely turn the pages or you really read, because your mind was everywhere, because there was no stress at all. Like a month before exam, if you want to concentrate, yes, you are able to concentrate well. But the same thing, 5 minutes before entering into the examination hall, somebody comes and tells you, this is the question which is going to come and this is the answer. You won't be able to register because you are at the peak of the stress. Like that, a certain amount of stress is good. After that, increase in stress does not increase productivity nor becomes counterproductive. That's what we call new stress. It's a plateau. But beyond that, if you increase the stress, it becomes counterproductive. And this again is very, very highly individualistic. So you cannot employ that in a group situation. And that's where probably culture and other things play a part. So by increasing the stress, I don't think you will be able to increase productivity beyond a particular level. So you must be able to highly personalize and individualize to what level of stress the individual will become productive. So it doesn't probably Western or Eastern cultures or doesn't mean. So it also depends upon the individual with responsibility. Individuals with good responsibility, they don't need external pressures, but individuals who are dependent on external pressures, they need to be probably pushed. So that's where a lot of things come into play, like you are responsible for yourself or somebody need to push you into the work. So even without supervision, even without anybody watching you, you are going to be working consistently. That kind of individual is not going to be helped by increasing the stress level. Whereas somebody who will relax without supervision, but he needs to be constantly guided and goaded, then he will be needed to be pushed by other persons.
Yeah, sir. Thank you, sir. The next question is like students with their preference, with their love only, they are choosing top institute like IIT, IIM, or NEETs. After cracking it, they are going into it. They are going by their love, but they can't handle their stress in that institutions and results in suicide. How
But
it is due to, sir?
okay, normally I've explained it to medical students and IIT students and all this. See, imagine, I wish I had a whiteboard to use it. Okay, so imagine, uh, like in the medical school with the reference to Tamil Nadu earlier, I used to say, like, now imagine 10 lakh students are appearing for plus two level. Only 10,000 students will be getting their medical seats now that the number of seats are increased. Earlier it used to be 2,000. Now almost, even now, it's about 1%, right? So the top 1% is entering into the medical school. So now if you draw a triangle, the top small portion, now you enlarge that. Now you have to be the top 1% to achieve that. And everybody belongs to that top 1% of the general population. Are you able to follow what I'm saying?
Yes, sir. Yes, sir. Get it.
You get a triangle, you cut the top corner, now you expand that triangle, and now you have to be at the top 1%. See that 10 lakh became 10,000. In the 10,000, if you have to be the top 1%, you have to be like the top 100. So you are competing with the best. Earlier you competed with the rest and you were the best and probably you were the top among your school, you came into that. Everybody who has come into IIT or everybody who have come into medicine are now the top 1%. So that the competition gets tougher. Like everybody who runs at the district level, they came first. Then they came to the state level. Not everybody can win. So that becomes tougher. At the state level, then you go into the national level. Then you go into the international level. Right? So at every higher level, the competition gets tougher. So people are finding it difficult to match, and there are a lot of peer pressure, social pressure, and all that, and years of hard work, and now they are not able to match up to others, and that's where these things happen. So that's why I said you need to probably, with passion also you come, but then you have to understand reality, and you have to understand what you are capable of, and you cannot compare yourself with others. In fact, since you brought in this topic, one of the important factors in producing stress, whether it is students or workplace or in life, it's because of comparison with others. So you end up comparing or others end up comparing you. So because of that, see, you cannot compare yourself with anybody else. So I often used to say, you can only compare yourself with your past and where you are now, where you were and where you are now, and where you want to go. Are you performing to your potential or not? If you are not performing up to your potential, what's preventing you? What are the blocks? Identify and relieve. But at the same time, somebody else might have progressed more than you. Like there was a boy who was getting 80% and he put in hard work. Another boy who also was getting 80%. Well, this boy put in hard work and he reached 90. The other boy put in hard work and he reached 95. Are you going to compare with the other person and say that he has gone to 95, I have come up to only 90? That will cause stress. If the parents compare, that causes stress. The spouse compare, that causes stress. So you have to learn not to compare yourself with anybody else, and even if others compare you with somebody else, you have to get out of that pressure. So that again I will say your self-esteem is good right from the beginning. You know what you are capable of, and your self-esteem does not depend on whether you're coming first or you're compared with others, and you know what your worth is, what your potential is, and you're performing up to that. That clarity you need to develop over a period of time. So the adolescent period, 17 to 21, is what you are talking about when they are in IIT or early stages of medicine. At that time, definitely people don't understand, and because of the pressure from so many sources, they give up. So they need to be trained in these aspects. So
Yes.
self-esteem, resilience, these are the things which we are talking about, which needs to be introduced at the school level, probably 12 to 15. That's the right age where you need to put it in the classroom to take it up so that they are trained well, and it will be preventive mental health. We can talk about like other people talking about preventing communicable diseases and other things. Definitely you can prevent mental health and positive mental health. You can introduce at the school level. 12 to 15 is the right age group where you can do it. If you have failed, probably then you can pick it up at the later ages.
Yes, sir. So one final question, sir.
Yeah.
Like freedom fighters, scientists, they have undergone many stress to give some new inventions or give some things, sir. But nowadays, current generation, we are doing just the assigned work, sir. But they have handled everything and overcome with victory. But we can't able to handle this assigned work. We indulge and we are developing and dwelling into stress. How to come out of that?
No, freedom fighters and all those people, they never experience it as a, that's what I'm saying. What they go through is not stress. How they perceive is what causes stress. Right? It is not the external reality, but how you perceive that in your mind is what is causing problem. So freedom fighters did not experience stress. They went through struggle but not experience stress. The basic difference I want you to understand. Struggle is not stress. They went through struggles, but they were comfortable with it. They did not, they wanted it. They were willing to come out of it. They went through a lot of failures. Still, they wanted to pursue with it. Whereas here, as you said, probably on the one hand, economic liberalization and other things changed a lot of things, but at the same time, one thing they did was remove the satisfaction. And that's causing a lot of stress, I would say. Probably in the good old days, only Doordarshan was there. People are happy to see song and song sequence once a week, one movie once a week, that too good old movie, not the latest, and still people were happy with that. Now you have 200 channels and you go through channel surfing and you are not happy with anything. And your attention span is not beyond 15 seconds. Earlier they had only two cards like Fiat and Ambassador. People are happy with it. There was no comparison. Today the school kid of 5 years or 6 years tells his father, if you bring this car and if you are going to drop me in the school, I don't want to come with you. Because the other boy is coming with something else. The gradation is so much, you are never satisfied with anything. Because there is always one limit above that. Multiple layers are there. So that's one of the things that has taken away our satisfaction as well as a children's level of ambitions and satisfaction level. So earlier you were satisfied with little things. In fact, when talking about diabetes, I always used to say, probably about 20, 30 years ago, a common man ate sweets only probably 5 or 10 times in a year. Now he eats 5 sweets in a day. Like if you go to a wedding, there are people where they have 10, 15 desserts itself and they compete with other people. The other relatives' marriage, they had this kind of food, so in our marriage it should be like this. And they end up spending lifetime earning on that one day. And they create stress for themselves by comparing, and there are a lot of gradations. And like earlier it was a joint family, lot of people with little comfort, and they enjoyed things. Now everybody, in fact, one of our friends was talking earlier, like in a wedding we went and their relative's house where we lied on the floor with 10, 15 people. Now they are asking how many bathrooms you have in your, I mean, bedrooms you have in your house, even before coming. So now they feel comfortable to stay in a hotel rather than this thing. So earlier people, the way they grew up, were willing to accept a lot of compromises and they were comfortable with it. Tolerance level was good. Interpersonal understanding and social skills were much better. Whereas in the modern day kid, the social skills are less because they don't play with other people. And in fact, in one of the books, Emotionally Intelligent Parenting, in the foreword, he has written an eye opening statement. Gone are the days where you can walk into anybody's house and then, like good old days, you don't even know where your kid was playing until 8 o'clock or 9 o'clock, and then suddenly call you would have eaten at some other place and everything was fine in the neighborhood. Now you cannot walk into a neighbor's home like just like that. No kid is like that, and social play is gone. So the kids are watching serials or TV, or they are moving with adults. So, in the very early growing up years, they are imitating adults. So, it's what they call pseudo maturity. It's not real maturity, but pseudo maturity. Even in a movie, young kid talks like an adult, but it's not a maturity, it's a pseudo maturity. So, the children have lost their social skills, adaptability, tolerance, and all that. So, these are the reasons for the modern day kids or the youth finding it difficult to face difficulties or inconveniences, or what they want they are not able to get, and immediately they feel it's stressful. So
Yeah, sir. Thank you.
another important thing one of my professor used to say is one of the important causes of stress is an inability to differentiate between the wants and the needs. Everybody is having their needs fulfilled, but their wants are not fulfilled. But there is a confusion between wants and needs, and you want the wants to be fulfilled as the needs. That's where the problem starts.
Yeah.
Yeah, sir.
Thank
Thank
you.
you for your good answer, sir. Over to you, ma'am.
Yeah. Thank you, Naveen. Yeah. Final question for today, sir. Suggest a permanent way to handle stress from Vetri, sir.
There is no permanent way to handle a stress. There is no easy option, right? So you have to identify the cause, what's causing you stress, and then work on it, how you can handle it and make it comfortable. Like, see, something happens suddenly, you can never be prepared. That kind of stress, you will be facing it. But what is causing problem is everyday stress, what's occurring on a regular, repetitive basis, that you can eliminate by your coping methods. Something, a disaster happens suddenly, will you be prepared for it? Never, it's not possible. But you can, by managing your minor stresses, common everyday stresses, you will have a mindset of managing even an unexpected stress. Definitely, yes.
Yeah.
So
Thank you,
if
sir.
you have to come back, I would say mindfulness. Mindful living is the thing which will eliminate stress in a permanent way, because you start enjoying everything, and also if you have an attitude of gratitude, and if you are counting your blessings rather than the problems, changing your focus, enjoying every little thing in your life, then you will have stress-free life. So if you have to have a final word, mindfulness and gratitude will help you to get out of stress.
Yeah. Thank you, sir. Yeah, Anita, ma'am, you want to interact with sir?
Yes, ma'am. Just one question, sir. For example, as parents, what are the kind of situations that we should make it? We should make the children comfortable so that they're able to handle stress. Sometimes they're not able to express it when they are very very young. They are not in a position to express it. How can we handle children and make them more comfortable?
Now, first is one of the important things I will say is allow them to talk. The parenting, most important thing is allowing children to talk more and parents to listen more. Whereas in most of the cases, parents talk more and the children don't listen. Second thing is they always say you have to connect first before correcting. But most of the parents are in the correcting mode rather than the connecting mode. Third, they go into a problem solving mode and they don't teach the kids or children to learn to solve their problems. So if they come out with a problem, listen to them and let them come out with a solution. And if you are not satisfied with the solution, ask them to encourage them to come out with, okay, what other things can you do? What other things can you do? So 5 or 6 different options come and then you ask them, which one do you choose and why do you choose and things like that. So this helps them in one, their own independent thinking and the final solution, even if it is your own, you make them feel that it has come from them. And the next thing is, it is helping them to solve not only this problem, multiple other problems by this way of generating multiple solutions. And another important thing I would say in parenting is make them responsible instead of you taking the responsibility for everything. Once you make them responsible for whatever they do and whatever they get, and you are there to guide them, they are in a better way, and that way the stress of the parents are reduced. Because most of the parents take responsibility for their kids when the children are going to plus 2 or college, the parents are more stressful than the kids themselves, and they end up transmitting the stress to the kids as well. Hope I have answered your questions.
Yes, sir. Thank you so much. Thank you so much, sir.
Yeah, thank you, sir. I thank viewers, those who are viewing today. Yeah, it was a wonderful session. We enjoyed thoroughly and we learned how to manage stress. I thank our teammates Sanita and Naveen. Yeah, special thanks to Dr. Srinivasan sir for sharing his invaluable expertise and insights on managing stress and engaging us and giving us 1 hour, 1 minute and stress diary. Then practical tips, having empowered us with the knowledgeable and tools to lead more balanced and fulfilling life. Yes, sir. We will come up with podcast next month. Thank you so much, sir.
Thank you very much for the
Thank you,
opportunity.
sir.
This
Thank you
message
so
reach
much. Thank you so much,
people
sir.
and then probably ease their lives from stress. Thank you very much.
Thank you, sir.
Thank you, sir. Thank you, ma'am.